Hello everyone, I am the Nurse Doc Tutor and I am here today to help you make 100 on your care plan. So I know that every nursing student, they dread care plans, but after this video, you should make 100 on your care plans. Now, if you follow what I say, you should make 100 on your care plans. So let's get started. Alright, so what is the purpose of a care plan? No, the purpose isn't just for your instructor to give you super busy work, even though that's what y'all think, but it's not. But in simple terms, a care plan is basically a roadmap for the care of a patient, and we'll get more into that. But that is basically how we plan out what we're going to do with our patients. Alright, so the first thing to do is find a problem, right? So in order to find a problem, we need to do what? Assess. So your assessments, you know, you got two types of assessment. You have objective data, which is measurable, right? So that's your blood pressure. That's you listening to bowel sounds. That's you feeling a pulse, right? All that is objective. And subjective data is going to be what the patient states. So it's going to be important to listen to what the patient says. If the patient says, I cannot breathe, if the patient says something just doesn't feel right. So that is going to be the first step. It is to find a problem. And if your patient is in the hospital, they have some type of problem going on. So it shouldn't be hard to find a problem in your patient. All right, so the second step is based on the assessment data, and you want to what? Find a nursing diagnosis that match the problem that the patient is dealing with. So this part right here is super simple because you don't have to do any work. So you want to get your NANDA book, or if your instructor gave you like a NANDA approved list, then you want to use that and pick a nursing diagnosis that matches the patient problem. So if your patient has problems swallowing, then we will pick impaired swallowing. If your patient has mobility issues, we will go to the mobility section in your care plan books. I recommend a care plan book because it makes it easy for you. So let's say if a patient has respiratory issues, I then will go to the respiratory section in the NANDA book and pick a diagnosis. This part is by far the easiest part because you don't have to do anything but choose a diagnosis from a list. So remember, you're not trying to remember these things. These diagnoses will be in a book. All right, so how to write a nursing diagnosis. So there are three parts of the nursing diagnosis, which we will go over each step. But just know that you got your problem, your etiology, and your signs and symptoms. All right, so the problem. What is the problem? So the problem comes from your assessment. So what problem does the patient have that you would like to develop a plan to approve? So a problem could be, your patient, like we said earlier, if they have impaired swallowing, or if the patient has impaired gas exchange. So remember, your problem is going to come from the NANDA list. The NANDA list, okay? So you're basically going to assess your patient. You're then going to look at your NANDA list, and you're going to say, yep, this goes with the problem that the patient has. So the problem part is already done for you. So just pick one that meets the assessment, matches the assessment, all right? So then the next part, which we get our related to part, right? So the etiology, that is the reason that the patient has the problem. So if you say that the patient has impaired swallowing, why does this patient have impaired swallowing? So you want to look then at the patient's history. You want to start looking at their charts and looking at their medical diagnoses and be like, well, wait, why does this patient has impaired swallowing? Oh, they have impaired swallowing because they had a stroke. Now, here goes the tricky part. So in your etiology, part of your nursing diagnosis, that cannot be your medical diagnosis. But I have a cheat code for you. use the pathophysiology of the disease. So what I would do is I would Google what is the pathophysiology of a stroke. So in other words, it is a cerebral infarction, right? So basically cerebral brain infarction, some type of blockage, right? So I would say impaired swallowing related to. So remember, with your second part of your nursing diagnosis, you have to put RT, meaning related to, and we said cerebral infarction. So cerebral infarction basically is a stroke, but is it cerebral infarction a medical diagnosis? No, it's not. So we're in the clear. So remember, this cannot be a medical diagnosis right here. All right, so the next and the last part is your symptoms. This is the easiest part to me, but this is the assessment data, whether it is objective or subjective. So this would be your vital signs, your physical assessment, your patient complaints, and etc. So we said impaired swallowing related to cerebral infarction as evidenced by patient complaining of difficulty swallowing. As evidenced by patient requiring a nectar thickened liquid diet. Does that make sense? So remember, you have three parts. You have your problem, which is your NANDA diagnosis list, right? We're just going to use our NANDA list. Then we have our etiology. What is the reason that this patient has this problem? But remember, it cannot be a medical diagnosis. So the cheat code is what is the pathophysiology of that diagnosis. And our S, which is our signs and symptoms, and this is actually the assessment data, whether it be objective or subjective. All right, so once you have your nursing diagnosis, we then want to move to our nursing goals. All right, so we now see a problem that we have in this patient, and now we want to begin to brainstorm and to plan some things to get this patient better. So it is important to know that nursing goals must be aligned with the nursing diagnosis. Stay on topic, you guys. So if our nursing diagnosis is impaired swallowing, we don't want our nursing goal to be patient will maintain stats, O2 stats of 95. What does that have to do with impaired swallowing? Nothing. So you want to make sure that your nursing goals are aligned with your nursing diagnosis, and you want to be specific, right? And you want to give a timeline whether your instructor is requiring you to do both short-term and long-term goals, but just make sure you just go off of what your instructor has said. But with your nursing goals, you want to be detailed. So let's say with our patient who has impaired swallowing, right? Our nursing goal short term could be patient will not have any signs of aspiration during my clinical shift, right? So that could be a goal. All right, so our nursing interventions. So after you have created a goal for your patient, this step focuses on how you will reach this goal, right? So what are some action steps that you can implement that will help the patient meet this goal? All right, so what are we going to do? The biggest thing where I see nurses go wrong with their intervention stage is they don't collaborate with the patient. So you may have all these things you want the patient to do, right? And you don't really collaborate with the patient. So that way, the patient is on board to agree with you. That even go back to your nursing goals. You know, if your patient is alert and oriented, they're able to say, hey, is this a realistic goal for you? Do you think that this is attainable? You know, and you kind of want to work with your patient. You just don't want to put a goal out there and start putting plans out there for your patient, and your patient is like, yeah, that'll never happen. You know, so you want to make sure that you work with your patient. So you want to make sure that your interventions match your diagnosis. Stay on topic. So if our goal is for the patient not to have any signs of aspiration during our clinical shift, one of our interventions could be patient will remain in high follower's position while they are eating. All right. Patient will, patient will eat on the approved diet by your the speech therapist. So you want to just come up with some goals. Come up with some interventions that will help you meet your goals. So remember, stay on topic. So if we're talking about our goal is related to aspirations, we do not need an interventions in that patient will use call light to go to the restroom. That has nothing to do with impaired swallowing. So you want to make sure that you stay on topic. And with your nursing interventions, you want to be detailed, because what a care plan is, a care plan should be where you literally get off your shift, you pass that care plan on, and that nurse is able to pick up where you left off at. So you want to make sure that it's detailed. All right. All right, so our rationales, this is the literature that proves that your intervention is effective to help achieve your goal. So our intervention was to keep the patient's head of the bed elevated while they are eating. Why? So literature says that the optimal position for a person feeding a resident who is laying in bed is to have the head of the bed raised at 45-degree angle. This angle, also known as Fowler's position, allows for easier swallowing and decreases the risk of aspiration, which occurs when food or liquid is inhaled into the lungs. So this position mimics the natural position of the body when sitting and eating, making it the safest and most comfortable position for the patient. All that is just an explanation of why this intervention will help us meet our goal. So remember, you don't have this information just stored in your head, right? So you want to go pick a credible source, whether it be your textbook. Your textbook is an awesome reference, or whether it be some type of credible source online. So remember, it has to be in APA format. So look up APA format and make sure it has in-text citations as well. All right, so our evaluation is our last step. So did your patient reach the goal, right? Why or why not? You want to tell, hey, did they reach their goal? Why or why not? Do you need to make any changes to the interventions, or should you give longer time frames? So sometimes patients are not going to meet all of our goals, right? That's why we want to make sure our goals are realistic, and we want to make sure our time frames are realistic as well. Sometimes nothing is wrong with the actual intervention, just the time frame on the goal may need to be longer. So you want to assess, again, during the evaluation phase, you then assess to see if this intervention has helped. So our goal was that our patient showed no signs and symptoms of aspiration during your shift, and then you're able to see at the end of your shift, did my patient have any signs and symptoms of aspiration? Yes, they did. So guess what? Goal was not met. Now, what do I need to do in order so that this goal could be met? So we may have to change around some interventions, or we may have to give the patient a longer time frame, or simply the interventions may be good, the time frame may be good, but your patient is just not there yet. So you have to be patient with your patient, okay? All right, so how does the nursing process and care plans go together? So the first part is assessment, right? And that's what we talked about. We actually talked about assessing the patient, finding something wrong with the patient, right? And then developing our diagnosis. So we then look at our NANDA list and choose which diagnosis fits the patient. And then once we get that diagnosis, we then want to start to develop a plan, right? We then want to have a plan on how we could better this patient. So during our planning phase, we come up with our goal, right? And then to meet our goal, what are some steps that we're going to take to meet our goal? That is all in the planning phase. The implementation phase, that is actually us doing it. So if we said that we were going to lift the head of the bed up, that is literally us going into the patient's room, making sure that the head of the bed is elevated. And then our evaluation phase, that is literally us assessing, did us keeping the head of the bed up, did that help prevent the patient from aspirating? So I know you're wondering, like, how the nursing process and what's the point of us even doing care plans. Do you see how I actually did a care plan out loud with you guys, literally with nothing written down? Y'all, I have nothing written down other than what's on the screen. So as a nurse, once you start to get experience and you become comfortable as a nurse, you will be able to do care plans in your head, honestly. So just be patient with yourself that, right now you may have to use a NANDA book or some care plan websites to help you out. But as you become more comfortable as a nurse, you'll be able to do this in your head. All right, so let's do this care plan example. All right, it said Miss Smith is an 89-year-old DNR who was admitted with a left hip fracture. She has a history of COPD and is currently on 2 liters of oxygen via nasal cannula. She says she cannot catch her breath when she is sitting in the bed. Miss Smith is alert and oriented times 1. Miss Smith was trying to get out of bed last night and she fell. And now she has a large skin laceration on her left leg. Miss Smith says her hip pain is constantly a 10 out of 10. So all of this basically was assessment data, right? So what I want you to do is go through the scenario and pick out the objective data and pick out the subjective data, okay? And then I want you to start to think, okay, what type of nursing diagnosis would fit this patient? All right, so what I came up with, the first one is impaired gas exchange related to bronchial constrictions as evidence-based by patient stated she cannot breathe when sitting in bed. So impaired gas exchange, right? So we know that she has respiratory issues, right? We know we're looking for a respiratory diagnosis because she's on oxygen. So that's an easy, remember, ABC, right? So impaired gas exchange related to bronchial constriction. What is bronchial constriction? That's just another way for saying COPD. That's just the pathophysiology of COPD a little bit. So as evidence-based by the patient stated she cannot breathe when sitting in bed. That's easy, right? Okay, so the next one, acute pain related to hip fracture. As evidence-based by patient stating her pain is 10 out of 10. Y'all see how simple this is? The next one is impaired skin integrity related to skin laceration. As evidence-based by the patient having a wound on her left leg. All right, the last one is a risk. So risk for infection related to skin laceration. So you guys, remember, when you are doing a risk for diagnosis, all you need is the related to. So this patient is at risk for an infection. Why? Because she has a skin laceration. She has an open wound. So I even could have said risk for infection related to open wound, right? Open wound on left leg. It's just however you want to word it. So I hope that this example helped made nursing diagnosis kind of click for you. So the care plan. So we're going to take one and we're going to take her priority one, right? Because ABC, we know that airway is going to be priority, right? So impaired gas exchange related to bronchial constrictions as evidence by patient stating she cannot breathe when sitting in bed. So the goal is patient will have an oxygen saturations will remain 90% or higher during my clinical shift. So what are some interventions that we're going to do? So we're going to assess the patient's respiratory status, which I put in parentheses because I want to be detailed, which are their respiration, their oxygen stats, and their lung sounds every 4 hours. So you see how I was specific, right? And I put a time frame on it. The next one is keep the patient head of the bed elevated at 30 degrees or higher at all times. The next one, administer breathing treatments as ordered by the physician. And the last one is to assist the patient in using the ascending spirometer every hour. So you see how I came up with some interventions that could help us meet our goal. All right, so then the next part will be the rationales, right? We would then explain why we need to assess. We would then explain why we need to keep the head of the bed up. We would then explain what do breathing treatments do to patients, for patients who can't breathe. We would then talk about how the ascending spirometer helps patients when they can't breathe. All right, so then we will go to our evaluation phase, right? At the end of the shift, we then start to look back at our charted data, our charted O2 stats. So we see that our patient remained at 90% or higher throughout our shift. So we know that our goal was met. So we will say, yes, goal met. Patients' O2 saturations remained at 90% or higher. You guys, I hope that this video has boosted your confidence in care plans, knowing that it's just not a waste of time. It is just not busy work, but it is actually how nurses think. It is how nurses do what we do. So I hope that this video just makes it simpler for you. If you do have any questions on this contact, reach out to me. I would love to be your private tutor to help you pass nursing school. I am the Nurse Doc, and I want to thank you for watching this video.